Hello, it's Dr. Elizabeth Alter. Are you on oral contraceptives, also known as birth control pills? There are some reasons why patients should absolutely not take birth control pills. This is usually discussed with your doctor. So, your doctor usually would discuss these things with you before prescribing the birth control pill or oral contraceptives. But I always want my patients to be informed consumers, so we'll go over today the reasons why patients should not take, the situations in which patients should not take birth control pills. So the first is any family history of clot. So blood clot in your legs, for example. So if there's a family history of blood clot, um, the patient should not be on oral contraceptives. There's also if the patient has high blood pressure. So this is between the patient and the doctor, but definitely if someone has high blood pressure, they should be careful being on the birth control pill because it can complicate that. The other reason is headaches. So if you have headaches with neurological issues, so meaning that maybe a side of your face gets numb or some sort of complications to your headaches, then that patient also should not be on birth control pills because it can worsen this. Then another important reason is if you smoke. Now, the general rule is if you smoke and you're older than 35, but if a patient smokes, even if they're younger than 35, they should be very careful with birth control pills. And lastly, if your blood pressure is higher than 160, so the top number, so blood pressure reading of 120 over 80, that's systolic over diastolic. So 120, the top number is the systolic. That shouldn't be higher than 160. So I hope this helps and have a healthy day. And thank you for following me on Facebook, Twitter, Instagram, LinkedIn, and have a healthy day. Bye bye.